Hello guys, and welcome back again to the channel. In today's video, I will be telling you about 10 different investigations which you can do to help you identify the cause of your infertility. If this is the kind of video you would like to watch, please stay tuned. But before I go ahead, it's very important that I let you know that you don't necessarily need all of these 10 investigations. In fact, it is very necessary that you see a qualified healthcare professional who will carry out a comprehensive assessment on you, and based on their recommendation, they will tell you or recommend which of these investigations will be most beneficial for you. So let's go ahead. But please do not forget to like and subscribe to this channel. Also hit that bell icon so that whenever I upload a new video, you will be the first to be notified. Now let's get started. As we all know, making babies is a business between a man and a woman. And when there are challenges or difficulty in achieving this result of, having a baby, it is very important or now necessary that both parties submit themselves for the required medical investigations. So based on that note, I will be starting on the very first one, which is especially for the man, and that is seminal fluid analysis. So when we talk about seminal fluid analysis, it's simply getting the sperm cells or getting the semen of a man and then using it to do some laboratory investigations. In this testing, the semen is now used or tested in the laboratory, and this is used to determine the quantity and quality of the sperm cells. So what happens is that the morphology, which has to do with the shape of these sperm cells, are checked to be sure that the shape of the sperm cells are okay and healthy enough to be able to fertilize an egg. Also, the motility is checked to help us find out that these sperm cells are strong enough to be able to swim to where the egg is located in order to fertilize it. So all of this is what is done in checking the semen, that is in performing the semen analysis. So when this has been done and it has been found that the semen analysis comes out as normal, then the man is ruled out in this case, and then the woman will be focused upon to find out what could be the possible cause of this infertility. So this takes us to the second test, which is the anti-Mullerian hormone testing. So what is this anti-Mullerian hormone testing? This is a kind of blood test that is performed on a woman to find out their ovarian reserve. So when we talk about ovarian reserve, it simply means finding out the number of eggs that is left in this woman's ovaries. So it tells us, oh, this woman has still enough eggs to be able to conceive, or this woman has little or no eggs left in their ovaries. So this kind of testing is especially recommended for older women, because it is found that as a woman gets older, the anti-Mullerian hormone gets, decreases with age. So it is usually recommended for older women. So when it comes to the results, decreased ovarian reserve is found in low anti-Mullerian hormone levels, while for women that have conditions like PCOS, they usually have elevated levels of anti-Mullerian hormone levels. So don't worry about this. Based on your doctor's recommendation, you might need to consider doing this kind of testing. So let's talk about the third one. So the third test you need to do is called the ultrasound, the pelvic ultrasound scan. So this pelvic ultrasound scan simply looks at the pelvic organs. So when we talk about the pelvic organs, we are talking about organs like the uterus, the fallopian tubes, and the ovaries. So it takes a good look at these organs just to identify anything that could be responsible for causing infertility. It looks at the uterus, which is also known as the womb. It looks at the fallopian tubes, checking for things like scarring or blockage in the fallopian tube. It also looks at the ovaries. So this ultrasound scan is also a very important diagnostic investigation, which has to be done when there is any suspicion of infertility in a woman. Then the fourth one, which is known as the thyroid function test, is also important, especially in people who are undergoing fertility treatments like IVF. So in this thyroid function test, we are looking at hormones like the thyroid stimulating hormones in particular. So an elevated THS level or anti-TPO antibodies, they are things that are not really needed in this situation, because some studies have shown that this can lead to miscarriages. So that is why it is usually done, as I mentioned, during treatment, before and during treatments like IVF. These are fertility treatments. So based on your own condition, your doctor might recommend that you do this thyroid function test. So the fifth investigation you need to do is known as the hysterosalpingogram. So unlike the pelvic ultrasound scan, which I initially mentioned, this one is an invasive procedure, because here what it actually does is to help check that the fallopian tubes are actually patent, that they are open. So knowing that the fallopian tube is open means that it will be able to allow the sperm cells to travel down to meet the egg in the fallopian tube. So this one is a more invasive procedure. Now, this one is also done at a specific time during the menstrual cycle. That is between days 7 and 10. That is when it is expected to be done. The sixth investigation is known as transvaginal scan. So this transvaginal ultrasound scan is very crucial when it comes to the treatment, or when it comes to finding out the cause of infertility. This is because it provides detailed and real-time images of these reproductive organs, thus helping in the monitoring and diagnosis of the various aspects of fertility. So this scan helps in the accurate assessment of the various reproductive organs like the ovaries, the fallopian tube, the uterus, and even the lining of the uterus. So you might ask, why do we really need to do this? This scan is really important because it helps to identify various things or various conditions which could be causing the infertility. Things like the presence of fibroids, polyps, cysts, and even endometriosis or PCOS. So that is why this transvaginal ultrasound scan is done. Remember, as I said earlier, you only need this when it has been recommended for you by a qualified healthcare professional based on their assessments and skills. The seventh test is testing for your prolactin levels. So when we talk about testing for prolactin levels, why do we need to test for prolactin levels, and what is prolactin? So to begin with, prolactin is a hormone that is produced by the pituitary gland in the brain. And this hormone is very well known for its good work of, helping in supporting breastfeeding. So it helps in the supply of breast milk after childbirth in women. So it supports lactation a lot, and it also supports the development of breast tissues during pregnancy. So now, why do we need to do this test? This is because when these prolactin levels are high, especially in women who are neither breastfeeding or pregnant, trying to get ready for lactation, then it can really interfere with ovulation, and this can reduce fertility in such women. So high prolactin levels in a woman who is not lactating at the time, or maybe possibly getting close to giving birth, such is not good for such women. And in such situation, it is recommended that you see your doctor for possible treatment. If you would like to know more about these high levels of prolactin, check my video about high prolactin levels. I made a more detailed explanation of this in that video. The eighth investigation you should do is testing for your progesterone levels. So what is this progesterone? This progesterone is also another hormone, and this one is produced by the corpus luteum. So what progesterone basically does is that it helps to thicken the walls of the uterus, the walls of that womb. So by thickening it, it makes it easier for that fertilized egg, which is now a zygote, to be able to implant in the right place in the uterus. So it thickens the walls of the uterus, making it easy for the egg to implant. And then it also helps to maintain this pregnancy until the baby is delivered. So it does a fantastic job for a pregnant woman. Now, why this investigation or this testing is done is that it helps to find out if ovulation has actually occurred or not. And it is usually recommended to be done in 7 days before your next cycle. So it's meant to be done 7 days before the next cycle. So let's talk about the ninth investigation. And this one is something that a lot of people do not really think about, which is testing for STIs, especially chlamydia, because it has been found to be a major cause of infertility in a lot of people. It is very important that you test for the various sexually transmitted infections. Now, the reason is because these sexually transmitted infections can cause what we call scarring. It's a complication of this kind of infections, usually pelvic inflammatory diseases. So they cause what we call scarring. They cause scars in the fallopian tube, thereby making it very difficult for the sperm cells to swim through the fallopian tube in order to fertilize the egg. So that is another very important investigation that must be done. So if you've watched till this time, thank you for watching, and please once again do not forget to subscribe to my channel and give this video a big thumbs up. Now let's talk about the very final one, which is testing for FSH and LH. So FSH means follicle stimulating hormone, while LH means luteinizing hormone. So these two hormones are secreted by the brain, and now what happens is that the follicle stimulating hormone is first of all secreted during the follicular phase. That is the time when this hormone reaches its peak. And this function is to stimulate the maturation of the ovarian follicles. So these ovarian follicles are stimulated to reach its maturity by the follicle stimulating hormone. That is basically what it does. Now, after it has finished its job, the luteinizing hormone is released, and this luteinizing hormone simply moves these mature ovarian follicles to rupture, and this is what we call ovulation. It leads or induces ovulation. So this is what the luteinizing hormone does, and it reaches its peak during this mid follicular phase. So at a certain time during the menstrual cycle, these two hormones are expected to be low. This is what we call the luteal phase. So at this time, these two hormones are expected to be decreased in amount. So these hormones, as I mentioned earlier, this hormone testing is expected to be done between day 2 and day 5 of the menstrual cycle. So having known about all of these 10 investigations, it is now up to you to have a discussion with your healthcare provider to know which of them will be specifically, beneficial to you based on your own circumstances. I just feel, or I don't know if you've benefited anything at all from this video. If that is the case, please do not forget to give me a big like and subscribe to my channel. Also, do not forget to ask any question you have down in the comment section, and I will be answering all of your questions. Do not forget to leave any topics or anything you want me to talk about in this channel also in the comment section. Thank you for watching, and I will see you in my next video. Bye for now.